Hello and good day to you. This is Tracy Harrison from the School of Applied Functional Medicine, and I want to invite all progressive healthcare practitioners where we're going to be delving into often overlooked disease dynamics. These are some of the nuances, the devil in the detail, if you will, about functional medicine interconnectedness that can get in the way of you helping each individual patient or client to achieve the optimal, the best clinical outcomes possible. And of course, this also influences your professional and personal satisfaction and fulfillment as a practitioner. Here at the School of Applied Functional Medicine, we have the great privilege and pleasure of supporting practitioners from all around the world, from over 75 different countries, hailing from 22 different professional modalities with a huge diversity of experiences and expertise areas and prior trainings. And so you're very welcome here in all of your diversity. And in particular, today I want to start off talking specifically about long haul COVID. We've been talking a lot about this dynamic, certainly in the realm of functional medicine over the past year plus. But here at SAFM, we've been doing a deep dive into some of the most common disease dynamics that are at play in long haul COVID. I've been saying for quite some time now that I think this wave of suffering and challenge is actually an auspicious opportunity for functional medicine to really shine, because long haul COVID presents differently in different people, and we're still looking for the singular cause, the singular physiological or biochemical manifestation or trigger for that. But certainly we know that behind the scenes, prior to their battle with COVID, individuals had all sorts of other functional imbalances in various foundational physiological functioning and biochemical balances that, of course, they brought to the immune battle. And so those are the aspects of imbalance that are much more likely to cause problems later on the other side of COVID. And we're talking about things such as insulin resistance and poor endothelial function, especially related to hypertension or atherosclerosis, individuals who already have respiratory dysfunction, maybe immune hypervigilance with chronic allergy or asthma. There are many pathways that can predispose people for certain flavors of long haul COVID, and we need to be looking for what's the particular basket of functional imbalances that are at play in a unique individual. And I want to start off by talking about one that I literally just finished a 2-hour deep dive case review with our students, going deeply into a case that one of the practitioners presented from their current practice. And it was a fantastic example of histamine intolerance. And that this is already an often overlooked disease dynamic in functional practice compared to so many of the other celebrity imbalances that we naturally tend to look for. But certainly in long haul COVID, you're going to find even more prevalence of histamine intolerance. And in particular, I think this can be a challenge for many practitioners, because when we think histamine, we may think necessarily about challenges with breathing or with airflow. And so many practitioners assume that if an individual has histamine intolerance, then it's going to present as nasal respiratory congestion or sinus congestion or some kinds of challenges with breathing. And that may very well be the case. But it's also true that plenty of individuals with histamine intolerance don't have any of those nasal respiratory sino types of symptoms. Instead, they may present with, for example, anxiety, especially anxiety paired with insomnia, and actually a very common symptom of histamine overload. And if you're working with a patient or client struggling with chronic anxiety who just can't get on top of what's causing it, I would encourage you to think about histamine intolerance. But insomnia can definitely be a driver for this. In fact, we know that there is actually a diurnal rhythm to histamine secretion from a human immune system. And studies have shown that the most common prolific hours are actually in the wee hours of the morning. Perhaps not a surprise, given that that is when our cortisol is often at its lowest. And so this can, of course, cause a buildup of histamine. Sometimes in the situation in the sleep room is also promoting histamine, whether it is just having stale indoor air that's toxic, or maybe there's mold or allergens such as beloved pets in the bedroom with you or even in bed with you. And so this can already promote a high histamine load. But then on top of that, our natural synthesis for it is going to be higher overnight. And this can actually be a reason why people struggle with awakening at 2 o'clock in the morning, 3 o'clock in the morning. There are other drivers for that for sure, but make sure that histamine overload is not something that you are overlooking. It's also true that histamine intolerance can contribute to nausea. And in fact, this can be a major contributor to people who have a predisposition toward frequent vomiting or nausea or also vertigo. And so we want to think about where histamine may be playing a role in this. In fact, actually during the first trimester of pregnancy, before the placenta is fully formed, because the placenta will make its own copious supply of diamine oxidase, the key enzyme that can degrade histamine and actually protect the fetus from having histamine overload. But of course, it takes time to build a placenta. And women who maybe are already on the cusp of struggling with histamine intolerance may find themselves dealing with really, really notable morning sickness or nausea, especially during the first trimester. And so we want to be looking for this bioindividuality. Of course, we also know that headache, asthma, joint pain, hypermobility syndromes, these are also common disease dynamic associations with histamine intolerance. So be sure to be on the lookout for this. Now, once you identify it, of course, we want to understand what are the sources and the triggers for histamine that a unique individual is wrestling with. But sometimes it's less about having a really dramatic load of histamine, but more rather that we struggle to degrade histamine. And as I mentioned, diamine oxidase is an essential enzyme that is synthesized in the gut, but also in other mucosas, such as in the bladder, in order to degrade local histamine challenges. But diamine oxidase is a brush border enzyme in the gut, which means that if individuals are dealing with notable states of dysbiosis or various types of oxidative wear and tear on the gut lining, such as in reaction to food sensitivities, especially IgA-mediated sensitivities, then we can end up with an impairment, a functional impairment in that brush border, and we're not able to make sufficient diamine oxidase, which means even mild histamine load from our food, from our diet, and then also as generated by our microbial friends in our microbiome, these can end up being excessive. And this is a real challenge because an overload of histamine in the gut can not only create frustrating symptoms such as bloating and cramping and diarrhea, but it can also contribute to enhanced intestinal permeability, which of course opens the gateway for systemic inflammation and immune hypervigilance and potentially molecular mimicry that is at the root of autoimmune disease as well. So be on the lookout for this particular disease dynamic. Mentioning common overlooked dynamics that contribute to insomnia, in addition to histamine intolerance, many practitioners don't see another critical imbalance that can be at play in restless, often interrupted sleep, especially people who have a hard time going to sleep, and that is GABA glutamate imbalance. So often we assume, oh, they're having trouble sleeping. It's either not enough melatonin or it's high cortisol levels, or maybe it's both. And for sure, Both of those are quite prevalent. But sometimes no amount of melatonin is going to help someone to sleep. And you may end up checking someone's cortisol levels and be shocked that actually they're not that high at night. And instead, we want to be thinking about the necessity of overall suppression of neurotransmission, the turning down of the volume level, if you will, on brain activity, so that there can be an opportunity for melatonin to work. And some individuals struggle with a more ruminating, hypervigilant mind, which of course can be promoted or exacerbated by all sorts of really poor sleep hygiene. We do all sorts of fascinating things in the hour or so before bed that can hyperstimulate our mind, our fear, our worry, our rumination, our remembering stressful things. We pay bills, we have arguments, we figure out just how busy and frustrating tomorrow's workday is going to be. We watch crime shows and the evening news, and we listen to fear-mongering podcasts, and we do these things in the hour or so before bed, and then somehow we think we're just going to turn off the light and that's going to shut off our minds. And for most people, that just doesn't happen, because we've jump-started the sympathetic nervous system, which of course is determined to protect us from death, from attack, promoting survival. And the sympathetic nervous system has evolved over millennia to not be deterred by sleepiness and fatigue. And so we need to practice good sleep hygiene in order to calm neurotransmission. But an essential biochemical aspect of that is making sure that we are readily able to interconvert from glutamate to GABA, the primary in stimulatory and inhibitory neurotransmitters, respectively, in humans. And we need to have ample amounts of GABA to just turn down the volume of that neurotransmission so that the rest of the biochemistry of sleep can actually take place. Now, individuals can struggle with GABA and glutamate imbalance for a number of reasons, and certainly poor sleep hygiene can be a contributor to that. But like anything else, our biochemistry in the human body is run on micronutrients, and individuals who have an inadequacy of vitamin B6 and or magnesium and or taurine, for example, may struggle with having optimal GABA glutamate conversion. For some individuals, there's already a hyperstimulation of glutamate activity, in part because of upregulation of the NMDA receptors that are triggering those glutamate, that glutamate activity in the brain. And so we've long understood that some people are vulnerable to having that from MSG ingestion. Some people are vulnerable to having that from the artificial sweetener aspartame. Certainly toxins such as lead or mercury can promote that as well. But an interesting disease dynamic in the realm of COVID, especially of long-haul COVID, is that the inflammatory cytokine interleukin-6, which is a hallmark of COVID disease, can promote increased blood-brain barrier permeability. And interleukin-6 can have a dramatic impact in upregulating glutamate activity and putting more of a burden, more of a necessity on ample GABA activity. And this is where supplementation can support GABA activity in order to just calm down the brain to enable people to sleep. Sometimes this type of supplementation can be a really intelligent intervention to stop the cycle of bad sleep, promotes more inflammation, promotes more disease dynamics, promotes bad sleep, promotes more inflammation, and so on and so on. And if we can simply restore some deep, consistent, restorative sleep, often the body will actually be able to get a sustainable progress with regard to countering chronic inflammatory dynamics. But otherwise, a poor night of sleep is increasing inflammation. It's upregulating NF-kappa B activity, for example, in our innate immune system. It is raising cortisol. It's raising blood sugar. And episodically, this is no big deal. But when this starts to become a pattern, even for weeks, much less years, this can be really dramatic. So you want to be looking for GABA glutamate imbalance and thinking about where supplemental vitamin B6, especially in the pyridoxal 5-phosphate form, and perhaps some taurine, but especially my favorite intervention that I've used hundreds of times for GABA glutamate imbalance is L-theanine, which is an amino acid that's an extract from green tea, actually, that helps to potentiate GABA. And so this can be really quite helpful, not only for adults, but it's also has been studied and shown to be safe for children. For example, young ones who are maybe struggling with ADHD. This can help to calm down their brain enough so that they can actually find some restorative sleep. But think about the impact of GABA glutamate imbalance and what might be upregulating it in a unique individual. It's a good reminder that loss of any barrier function in the gut can contribute to disease dynamics. And it's not just a matter of leaky gut or enhanced intestinal permeability, right? We can have leaky lungs, leaky skin, leaky arteries, and yes, leaky blood-brain barrier. And good fences make good neighbors. And when barrier function is impaired, this is when we can end up with a forward-feeding downward spiral that contributes to chronic disease. We want to always be thinking about the effects of medications. And in particular, we need to think more often about asking people about what they used to take. Oh, they may say, I'm not taking any drugs. But if we're not asking, have you stopped taking anything in the past 2 years? We may not understand that they were taking proton pump inhibitors once or twice a day up until 2 months ago. That would start to explain the overt impact on their digestion and then the downstream insufficiency, for example, of key minerals or amino acids that are needed for various biochemical conversions. When we take a PPI or an H2 receptor blocker, we are busting digestion on purpose in the name typically of acid reflux relief. But it is creating maldigestion emphatically, and it has downstream effects for sure. We want to be thinking about the impact of using beta blocker medications for hypertension. We know that this has a degradatory effect on the body's synthesis of melatonin and CoQ10. Melatonin being absolutely essential, not just for sleep, but as an antioxidant. And especially you want high overnight levels of melatonin because of its powerful antioxidant function for healing oxidative damage to the lining of our arteries overnight. This is one of the reasons why you want to be a big dipper overnight and experience a substantial drop in blood pressure, something that you can't really see unless you do a 24-hour monitoring of blood pressure to know what the full diurnal cycle looks like. Because a nice big dipper, a drop in blood pressure overnight, can actually rescue an elevated daytime blood pressure and protect the arteries from further cardiovascular disease dynamics. But we want to be thinking about where medications may have unexpected effects. We know that steroids are immunosuppressive, but we don't necessarily think about the role of things like steroid inhalers still having a suppressive impact on endogenous cortisol levels, or causing an overt suppression of immune function in the mouth and the esophagus and the nasal respiratory cavities that might be contributing to some type of chronic localized infectious dynamic. For example, thrush or some type of viral dynamic in the nasal passages, right? We want to be on the lookout for these things. Another area that we want to remember about in the realm of neurotransmitters is, again, micronutrients fuel our biochemistry, and we need amino acids and B vitamins and mineral cofactors in order to synthesize serotonin and acetylcholine and dopamine, right? We obviously have to synthesize these powerful compounds. But one of the interesting dynamics we're seeing as a result of COVID is that individuals can be suffering from suboptimal serotonin levels on the other side of COVID disease. And part of this is the normal metabolism of tryptophan. We think about tryptophan as being essential for serotonin synthesis and then serotonin for melatonin. But the primary metabolic pathway for tryptophan is actually not for serotonin. It is shunted over into what is called the kynurenine pathway, which is used for the synthesis of vitamin B3, by the way, niacin. That's how the body makes endogenous niacin. But the kynurenine pathway is also used to support immune function, and in particular in high viral load states or other infectious dynamics. And this would be escalated when those are sort of chronic simmering dynamics that we've sequestered but we can't fully resolve. More and more tryptophan gets shunted to supporting immune function, which can leave inadequate levels for serotonin. And so when you are seeing individuals who may be struggling with sleep downstream from that, because you need serotonin to make melatonin, but thinking more about some of the symptoms of suboptimal serotonin activity, things such as dysmotility in the gut, exaggerated pain perception, cravings, having trouble with impulse control, maybe having a more addictive personality, especially where individuals are self-medicating with serotonin promoting activities such as addictive drinking or eating or pornography or gambling or these types of things that might be promoting serotonin and to a second degree dopamine as well. These individuals may be struggling with suboptimal synthesis and activity of serotonin. Part of that, especially in the era of COVID, may have to do with suboptimal levels of tryptophan. It's an essential amino acid. We have to get it from our food, from our diet, or from supplement. And another interesting catch-22 is that we have lots of ACE2 receptors in the gut. And some of you, I'm sure, maybe like me, your particular experience with COVID disease was more gut-centric. It's estimated that as much as 25% of COVID cases are more gut-centric. But even if the gut plays an only minor role in an individual's particular COVID illness, of course, we're going to have oxidative damage to the tissue where the immune battle primarily took place. And this is going to be in and around ACE2 receptors. And so what this means is that ACE2 receptors may not be able to optimally play their role of supporting tryptophan absorption in the gut. There is a chaperone function of ACE2 receptors for making sure we can actually absorb the tryptophan that we eat and digest and hope to absorb for purposes such as making serotonin. And so this is a disease dynamic, a tryptophan depletion that you want to think about in the case of any chronic simmering infectious scenario, but I think especially high viral loads, and certainly a pertinent consideration in the face of long haul COVID. Now we're talking about the gut, and another key aspect that is often overlooked is the body part that is so often overlooked as a root cause of disease. And in fact, many people, maybe not overtly, but behaviorally act almost like it's outside of the scope of medicine. And that has to do with our mouth. So often we relegate oral health to the realm of dentistry, and we're not thinking about the mouth actually being the top of the gut, right? The lips, the tongue, the mouth, the teeth, the gums. This is the top of the gut. And if so much disease begins in the gut, then for sure we need to start thinking about how much gut dysfunction begins in the mouth. I think we'd be surprised to learn just how much. Given what the mouth tends to be exposed to, especially in our modern cultural habits of eating crap food, right? Calorie, chemical-laden foods, but foods that are perhaps low on micronutrients, maybe foods that are high in antibiotic residue, which have the progressive suppressive effects on biodiversity in our microbiome. So much of what is happening, we're dealing with in the mouth. We know actually that the beginnings of tolerance in the human immune system begins with oral tolerance. And so, yes, we want to have healthy lips and gums and mucosa. We want to make ample amounts of secretory IgA. We want to have good production of saliva. We want to chew our food very thoroughly in order to give immune function in our mouth plentiful opportunity to get exposed to and get comfortable with what we're eating. We want to break down the foods in order to minimize the possibility of maldigested food downstream in the gut becoming antigenic in nature. And so chewing matters, right? Dry mouth matters. The health of the tongue matters. And yes, dental history matters. Absolutely, oral hygiene is essential, but there can be an awful lot of seething infectious dynamics happening in the mouth. And you're likely already familiar with studies that look at strong associations, for example, between cardiovascular disease and circulating elevated levels of antibodies to infectious dynamics that are known to occur primarily in the mouth. Maybe, for example, associated with infected root canals. We still widespread practice putting one of the most toxic substances on the planet in the mouth, as though that's a passive benign thing to do. While the dental practitioners wear significant protective garb and protection from their own breathing. And so, of course, this mercury is outgassing and being inhaled and being swallowed and being absorbed through the mucosa. So we've got to start thinking about what is going on in the mouth. What is the association in a unique patient or client with dramatic changes in dental or periodontal disease associated with systemic disease? Sometimes we can be surprised. So let's see, other dynamics we want to think about in terms of often overlooked realms has to do with metabolic disease. And this one deals more with the fact that we often act too late. In the functional medicine world, we talk about the importance of engaging early on when you start to see functional imbalances and not waiting for an overt marker of disease to be elevated, even subclinically, but so often we're waiting it to be elevated enough to be clinically official, and then we can name it, blame it, and tame it with a certain pharmaceutical regimen. But so often the disease dynamic that caused it has been ongoing for 2, 5, 7, 10, 15 years. And a huge amount of suffering has happened on the part of the patient in the interim. But it's also key that a significant amount of damage has often happened in the body, loss of vitality, loss of functional balance that has allowed secondary and tertiary imbalances to manifest when we could have acted earlier. We could have lowered the bar for deeming a functional imbalance to be worthy of clinical assessment and intervention. And there is perhaps no better example for this than metabolic disease. Because even published research shows that by the time a person is ready to be diagnosed with, say, type 2 diabetes or even prediabetes, metabolic dysfunction has been at play on average 13 years. 13 years in adults. And so what are we missing? We're missing the early warning signs. And obviously an awful lot of prevention could be affected by looking at things such as stress levels and high glycemic diets and sedentary lifestyles. But if you studied metabolic function through the functional medicine lens, then you know that before blood sugar goes high and there is loss of pancreatic function, endocrine pancreatic function to supply ample insulin to keep blood sugar levels optimal. What has happened in the 3 stages prior to that has much more likely been episodes of hyperinsulinemia, much more likely to been episodes of fatty liver, that happened beforehand, where there has been an incidence of loss of muscle mass and higher levels of incorporation of fat into skeletal muscle, and so a shift in body composition. And as hyperinsulinemia grows in a long stage 2 level of metabolic dysfunction, you're actually going to be more likely to see hypoglycemia than you are to see hyperglycemia, because the elevated levels of insulin that the pancreas is putting out proactively in an adaptive way to handle the excessive glycemic load of your life, then this higher level of fasting insulin is going to be more likely to predispose people to low blood sugar or hypoglycemic incidence. This is where we need to be very cautious about not taking lab work at face value. At SAFM, we teach, see the person first, and then take a look at their labs. If you look at people's labs first, you're putting a very constraining filter over your intelligence, over your wisdom, over your intuition. And then you're trying to see the nuances of this rich human being filtered through the tight lens of labs, and we miss so much. If a person is eating a crap food diet and lots of refined carbohydrates, and they are not only overweight, but they're over fat, and they have a sedentary lifestyle, and their hemoglobin A1C is 5.0%, something in our minds should go off and say, that's not logical. That's not logical. Why do they have a seemingly optimal A1C when they have these metabolic dysfunction promoting lifestyles? Well, you may check fasting insulin and find that it's subclinically high or even clinically high, and that is artificially, if you will, driving down their blood sugar. But the seeds of metabolic dysfunction have been planted. We need to be looking, not just scanning labs for clinically high and low flags, but we need to be looking at lab markers and questioning, where did these results not make sense for this person, for this human being, for this life system, for these lifestyle choices? Because often what you have is actually 2 disease dynamics at play, one that is more suppressive and one that is more elevating, and they're colluding to create a seemingly optimal lab marker. But as you start to understand who they are as an individual, you can see the dysfunctions that are at play so that you can address them before they create some other severe type of disease manifestation. And so we want to be looking for this. See the whole person before we think about looking at the lab, so we don't miss critical case nuances. Now, of course, we know that having good amounts of digestive secretions and having excellent absorption in the gut is essential for nutrient sufficiency in the human body, and there's all sorts of essential nutrients. But minerals are something that's another hot topic in the realm of COVID, in terms of what might be at play. And I was talking earlier about histamine and histamine intolerance, and how individuals can struggle with a skewed or dysregulated immune system. Certainly a mineral that has achieved celebrity status during the pandemic is zinc. Even if people have never heard of zinc before the pandemic, they certainly have now. And actually what I've learned is odds are quite high that they might be taking zinc supplementally. In fact, they might be taking notably high doses of zinc, and maybe multiple times a day. And this is where we need to remember that all minerals to some degree compete for absorption, especially at the gut level. But some minerals compete more than others, and not only at the gut, but also at the cellular level. And if you have had more oxidative wear and tear at the gut lining, especially secondary to COVID, because of the ACE2 receptor prevalence in the gut that I mentioned earlier. But even if people have ongoing dysbiosis, right, a chronic IBS dynamic, maybe a SIBO type of dynamic, or food sensitivities or intake of toxins, but things that are that we are wrestling with oxidative wear and tear on our villi, and we simply don't absorb nutrients as well as we need to. And so people can end up with insufficiency of zinc, copper, selenium, molybdenum, manganese, and so many more, magnesium, so many more minerals. But when individuals are taking pure zinc supplements, especially high dose, especially multiple times a day, over time they're very likely to create insufficiencies in other minerals because of this competition, and in particular copper. So we tend to focus on somehow zinc is good and copper is bad. This is a real misnomer in the realm of functional medicine, and it makes sense because certainly people can have copper overload, and that is common where there's high chronic stress states. Higher estrogen states naturally increase absorption of copper. And we know that disease states can promote more mobilization of copper from tissues and more absorption of copper from the gut. And so we can have copper overload. But I think it's an interesting artifact of the pandemic that you can have excessive zinc supplementation and create inadequate copper in contrast to that. And we think about zinc being essential for immune function, but copper is also essential for immune function. Even the synthesis of white blood cells itself requires zinc and copper and B vitamins. But even key antioxidant function, we think about things like superoxide dismutase being critical with regard to mitochondrial antioxidant function. We need zinc and copper in order to optimally absorb iron from the gut, in order to optimally mobilize iron to make hemoglobin, to have good circulation. You need copper. If people are supplementing with excessive zinc and driving down their copper, they may end up with iron deficiency anemia. And we have to think about what is at play in a unique individual. And so the opportunity here is to make sure that we do a keen check of supplements and that we aren't in pursuit of a good thing, creating an imbalance that ends up having secondary effects. So many practitioners are really skilled in finding the dysbiosis, find the pathogen, run the stool test, right? Find the culprit, find the trigger. But if we don't address the underlying functional imbalances in the gut, then it's highly unlikely that the person we help with a pathogen or a dysbiosis is going to get well and stay well. The natural outcome will be recurrence. The natural outcome will be another day, another stool test, another treatment. 3 months later, more suffering, another stool test, another treatment, right? It's what I call the revolving door of dysbiosis. But if we address the terrain, the environment that allowed the dysbiosis, now we actually have a chance of individuals being able to get well and stay well because we've corrected for that unique person what is underlying the gut dysfunction. I do want to mention just a couple of other often overlooked dynamics that I want to be sure you have in mind with regard to your practice. And for, let's see, I've got several I could cover. I'd like to keep talking about the gut because one of the things that is so often overlooked in the realm of functional medicine is the role of stress. And I want to just acknowledge for all of us that talking about stress and trying to teach patients about the importance of reducing stress, that's about as interesting for most of our patients as learning to chew their food better, right? The stress in our sociocultural environments has become certainly widely blamed, but also widely tolerated. Instead of doing something about our stress, we're more likely to joke about it or in some ways celebrate it. I don't know, as a gesture of the more stressed we are, the more important we are, the more valuable we are, the more sacrificial, the more of a martyr we are, we're putting up with the world and all of the stressors in our lives. It's sort of a warped perspective when you consider just how much dysfunction in the human body is being perpetrated by stress. Because when we are wrestling chronically, not just with emotional stress, but mental stress, physiological stress, toxic stress, infectious stress. When we're struggling with all of these things, the body behaves differently. When we're in a sympathetic nervous system mode, we have different muscle contractions and glandular secretions and hormone balances and neurotransmission. There's certain physiological function in the body that when you're in a sympathetic mode, fighting, flighting, and hiding, there's certain physiology that is suppressed on purpose. It's turned down on purpose because from the body's evolutionary wisdom, it doesn't make sense to try and prioritize them when we're worried about just getting till tomorrow. We're worried about trying to make it till tomorrow, to survive, to get through the night. And so we have to talk about stress in a way that patients and clients can understand and be inspired by. Not just hear you, not just nod, but be inspired to make change. And this is where we have to teach people some of what is actually at play in their unique body that is a natural, expected, logical outcome of their stress state. And therefore, there will be no sustainable resolution until we deal with the source of the stress. And for many people, it can be hard to find the sources of stress. This is where, whether a group program, if you're in an entrepreneurial model, or if you're in a conventional medical model doing a group visit, maybe a multi-group visit type of session, talking about stress can be really palpable as a group, where people can share perspectives and their own insights can be provocative and insightful for the other people in the group. But where we can share stories and tools and resources and solutions to actually do something about the stress in order to reduce its physiological and biochemical effect in the disease dynamics that people are struggling with. You know, teaching people that sleeping lightly and restlessly and for not very long is a 100% logical, helpful, expected outcome if your body thinks you're fighting, flighting, and hiding for your life. Because if the human organism was able to sleep deeply and just conk out when you were being chased by something threatening your life, humans would have died out a long time ago. So it's actually a wonderful evolutionary attribute that we know how to survive by deprioritizing sleep in a serious way. But the body's vitality assumes that the threat ends and that we do have the opportunity to sleep deeply and for longer periods of time and prioritize rest in order to allow healing and restoration of reserves and vitality on the other side of that stress. And so we have to help people get started with stress relief, and we have to pick things that are accessible for the average person. I mean, if a person is stressed out of their minds and you can see it and they're frenzied, meditation is not accessible to them. It's too much, too fast. They'll likely nod at you and say, that sounds great, but they would not be able to pursue. And so this is something we have to teach people about in a way that is inspiring. It's why we focus so much at SAFM, not just on the science. The science of functional medicine is amazing. And the geek in me sees the geek in you. We can talk about the interconnected science of functional medicine all day, but it's not enough. It's not enough. If the 100 of us have amazing knowledge, but we don't know how to parlay that into a clinical encounter that educates, inspires, and empowers someone to change their behavior so they get well, well, then, my friends, our knowledge, no matter how erudite it is, isn't really worth very much. We're in this work to change lives, to restore to people their vitality, to restore to people autonomy and ownership and confidence about their own health. And so knowing the science isn't enough. We have to have really savvy clinical application skills. And it's why we focus hugely on it at SAFM, because we have to go beyond the science. Yes, we have to have savvy bio-individual case assessment and customized intervention plans so that we go beyond a protocol, right? We know that a diagnosis isn't enough, because just because you know the agreed name for a collection of symptoms doesn't mean you know what's causing it in a unique person. But even in the realm of functional medicine, if you know what's causing it, you've got to customize an intervention plan that this individual is ready, willing, and able to actually pursue. And that it brings in both the science as well as the art of the practical application of functional medicine in clinical practice. And so we want to be thinking keenly always about, who is this person? And I need their help. I need their guidance. I need their intuition. I need information about what they're ready to prioritize changing, where they're ready to embark on a different set of choices. If they're not ready for the whole intervention that you think would be helpful, what starting steps are they ready for, right? Even the journey of 1,000 miles begins the first few steps, right? Lao Tzu reminds us of that wisdom. We have to begin somewhere. And I can't tell you how many clients we've supported just in my practice alone over the past 15 years, where people went to amazing functional medicine practitioners. They got awesome assessment. They got awesome explanation of what is at play. And they walked away, I don't know, with a list of 15 or 20 supplements, but it all just felt overwhelming. Too much, too fast, crazy overwhelmed, don't know what to do first, don't know how to make all this fit with my life and all my constraints in my life. And so 5 years, $5,000 later, what has been the net improvement in their health? Nothing. Zippo. And I know that if you're part of this community, your passion isn't just geeking out on functional medicine. Your passion is seriously up-leveling your clinical outcomes, right? You want to help people to reclaim that vitality. And you as a practitioner finally want that fulfillment, that deep satisfaction of knowing that your partnership helped the unique individual achieve that, right? Give me a thumbs up or a heart if that resonates with you in terms of why we do this work, right? Of course, the science is fascinating, but that's not why we do it. The science is only a tool. The science is a vehicle. But our destination is really about helping people to go from feeling, fine, wrestling, struggling, experiencing the same progressive degradation of health via chronic disease that everyone does, right? We're not settling for that. We want to actually help people to find and reclaim true vitality, where they actually have some days where they feel fantastic, where they actually experience, whoa, okay, I had no idea how bad I felt until I realized just how good I could feel. And when people feel that again, it raises in them a natural vitality and reciprocity that allows them to give more generously of their skills, of their gifts, of their expertise, of their heart, of their vulnerability, whether they are a parent or a teacher or an engineer or a peacekeeper or a problem solver or an artist. We have more to give when we truly feel well. And in that sense, what you're doing with this work is not remotely just limited to healthcare. When we engage in this work and we partner with people to help them truly store vitality, what we're doing is giving back to the world the gifts of all of these brilliant, unique people feeling well and able to give generously of their gifts. An abundance that the world really needs in order to solve all of the challenges that we're facing today. Thank you for what you do in this world.